Hello, I am Dr. Chaitra, Director of Nation Care Homeo Clinic, consultant and family physician at Homeopathy, practicing at HSR Layout, Bangalore. Diabetes is one of the world's most troublesome factor or the disease. Out of 10 people, 6 you will see either the people will be in the pre-diabetic state or will be in the diabetic state. What is actually diabetic? When we tell the patient is diabetic, so usually when the glucose values in the blood raises within the normal limits. So for example, FBS fasting blood glucose should be there within 90 to 100 and the PPBS postprandial glucose level should be there in between 100 to 140 up to 150 is also fine. But when these values exceeds even the FBS or even the PPBS, we categorize this whatever the patient will be in a diabetic state. And when we consider as HbA1c, this is 3 months average blood sugar that should be within 5.5. When it is in between 5.5 to 6, we categorize them under pre-diabetic state, and above 6, we categorize them under diabetes. So, diabetes, what is the major troublesome factor? It is a metabolic disorder. Diabetic is a metabolic disorder which involves each and every cell of our body from top to the toe. So even the skin includes even our heart, kidneys, lungs, liver, eyes, pancreas, and whatever the organs are there in our body. In all the organs, the diabetic or this whatever the influence of the glucose definitely will be there. So what are the causes of the diabetic? Usually, as everyone knows, our lifestyle and stress are the major causes for the diabetic. But when it comes to food, lifestyle diseases, everybody knows what to eat, how to eat, but we will not try to make an attempt to sacrifice few things in our life. That is the major problem for the diabetic issues. The causes will be irregular eating of foods. Like for example, some days they'll eat in the mornings and some days they'll skip the breakfast. Sometimes late nights of eating, lately sleeplessness nights also contributes to the diabetes. So what is the symptoms you will see? What are the symptoms? When it comes to symptoms, patient feels, it depends on the patient to patient. Few people will present their symptoms in different way and the other patients will present their symptoms in a different way. So when it comes to a major, whatever the symptoms, we will see more thirst. The patient will have more thirst to take their water and more appetite. Frequently, the patient will have more appetite for the food and frequent urination will be there, excess of sweating will be there, weakness and hair falls, hair dry and skin also all over body, skin feels like very much dried and anxiousness will be there and fatigue will be there. When it comes to ladies, there will be irregular menses or scanty or profuse menses based on their hormonal issues. All these are included with the symptoms of diabetes. So when it comes to food, is that few patients might be telling after taking or after following a few certain guidelines from the doctors, even though the values are in the limits. We need to be very focused with the diabetic, like taking what kind of foods is important. Removing all the sweets or whatever the rice from your diet will not fix your diabetic values. But the way of taking food is also matters a lot. See, from the fiber, carbohydrates, proteins, and the fats, everything should be included in our diet. And how to take those foods are very important. For example, few patients will take only chapatis. That is not enough for the diabetic values to control. You will be losing proteins from your body. Multiple factors will be there to control the diabetic. And the thing is, lack of physical activities is also one of the major problem for the diabetic. Diabetes can be managed with stress-free life and proper physical activities and proper intake of foods. For example, take fiber and protein-rich foods regularly on time. For example, morning, afternoon, and the night. You need to pick certain time for having your foods. When you fix and if you take regularly on time those kinds of foods, definitely the values will be controlled and can be sorted out. When it comes to homeopathy, even we will suggest the medicines for the diabetes and those who are already under insulin also, we will take those patients to minimize their insulin intake and gradually we'll start with our medicines over a period of time. The patients feel, and the patients who are taking two tablets might reduce it to one, and the patients who are taking insulin, we can reduce the dosage of insulin also. And with our medicines, definitely it helps you out without any other kinds of complications. And when it comes to the case taking will be different, and it is different for each and every patient based on their family history and the personal history and the mental history. The patient's information has been taken from the doctor, and usually it is we will match the medicines, our medicine, with the symptoms what the patient already told. So based on that, medicines will be given. It will definitely help you to maintain or balance your diabetic values. So we have a few medicines like phosphoric acid, cesium, or phosphorus, or other kinds of homeopathy medicines. Based on the symptoms, we will be given the medicines for complete recovery. Everybody has a doubt regarding diabetic, whether it can be reversed or not. Diabetic can be reversed with the proper guidance, with the proper balanced meal, or with the proper physical activities. A reversal has is one of the important thing in the diabetic. Even though if your values are 200, even though if your values are 300, even though if your B1C values is 7 or 8 kind of thing, with proper guidance in the sense of diet, in the sense of physical activities, definitely diabetes can be reversed in our clinic, and we'll be helping you on the diet, how to take, what time, which food to take, and what food has to be taken regularly. So all regarding diet, 50%, whatever the medicine you take, it will help. Remaining 50%, your lifestyle and your diet matters a lot, not only with the diabetic, it is with all kinds of diseases what you suffer. Your lifestyle and a few modifications has to be done to come out of this complications. And if the diabetic is not treated properly, if the diabetic medicines are not taken properly, it leads to major complications like diabetic neuropathy, diabetic nephropathy, and cardiac issues, and multiple complications might start. In that stage, it is difficult to reverse. If you identify the diabetes values earlier, then it can be reversed definitely, and it helps for you to have a healthy and good life. The food also helps you to maintain the diabetic values.